Today, the North Carolina Senate passed a bill that would end Planned Parenthood's status as a Medicaid provider in the state. North Carolinians on Medicaid have been able to go to Planned Parenthood clinics for cancer screenings, infection testing, and more. We should note that the state already does not pay for abortion services. Republicans, though, want to end Planned Parenthood's Medicaid contract anyway because they just don't trust the organization. Planned Parenthood pushed back on that today.
The reason that I don't think that Planned Parenthood should be providing these services is because I think that they indoctrinate.
Cancers will go undetected, STIs will go untreated, and people will not be able to get the birth control they need to plan their families and their futures.
So this is all part of a much larger conversation around the future of Medicaid in North Carolina. Ashley is here with WRAL State Government reporter Paul Spey in the studio tonight for that part of the story.
Yeah, we got to get the NCCAP team in here. They're the experts on this. The vote, Paul, was on party lines. Democrats against it, Republicans for it. Republicans have controlled North Carolina's laws for 15 years. Why is this bill coming out now?
Right. I wondered the same thing. Why haven't they addressed this until now? But the answer lies in the federal government. Recently, the Trump administration and Congress passed a bill, you may remember it, the One Big Beautiful bill, that would do a number of things, but one of them would be to block Planned Parenthood from funding Medicaid funding at the federal level. Mm-hmm. Now, Planned Parenthood is fighting that in court, but a judge recently ruled that the Trump administration can move forward in that case. Well, that frees up states like North Carolina to move forward and do the same thing here.
I see. So really, it was the federal government that almost acted as a catalyst for the North Carolina lawmakers who wanted to push this forward.
That's right.
Okay. Medicaid at the center of quite a few debates at the North Carolina legislature. So how does this play into the bigger picture here?
Right. This bill comes as North Carolina legislators are trying to provide more funding for Medicaid. Just this summer, the state health department said that they didn't have enough funding to move forward in the current fiscal year. They're almost $200 million short. Right now, the Senate and the House have different proposals for addressing that. One of them, the Senate proposal, includes an array of other things, not just Medicaid funding, but also funding for a children's hospital in Apex that would break ground in 2027, and something called NC Cares that sends money to rural parts of North Carolina. Now, the House says, hey, we don't have time for all that. The health department is going to start cutting reimbursement rates for Medicaid starting October 1st if we don't do something right now. They want a clean bill that includes nothing but Medicaid funding. And right now, there's no deal in place. The two sides, as of today, are sticking to their guns or sticking to their individual proposals.
Okay, so the fund, it's not like there's going to be this whole new money that's going to be freed up here. They want to reallocate the funds. Right,
so the funding itself is not going away. It would still be there. Planned Parenthood would just be stopped from accessing it. Republicans pointed out today, these supporters of the bill, that you can get these same services from other organizations. Many of them mentioned county and local health departments. Mm-hmm. Well, Democrats pushed back on that and said, hey, a lot of people are used to going to Planned Parenthood, and in many communities, they have more trust than the local and county governments do. One state senator from Cumberland County said in Fayetteville, the Planned Parenthood is across the street from the mall, so kids can be dropped off there, and if they want to go get tested discreetly for STIs, cancer, whatever, they can do that. But now they'd have to go to somewhere else.
Okay, really appreciate the discussion. I know you've got a lot more online, so if you have more questions about this, you want to kind of go back and look at this again, head over to WRAL.com. Paul, appreciate it.
Thank you.